Hepatic Failure by Pauline, Victoria, and Kendra. Objectives. By the end of the presentation, student nurses will identify risk factors for developing hepatic cirrhosis. Student nurses will interpret laboratory test findings commonly seen in patients with cirrhosis. Student nurses will analyze assessment data from patients with cirrhosis. Student nurses will describe the role of the nurse in monitoring for and managing potentially life-threatening complications of cirrhosis. Student nurses will explain the role of the nurse when assisting with a paracentesis procedure. Pathophysiology, risks, and causes. Liver cirrhosis is a chronic, progressive disease of the liver characterized by diffuse degeneration and destruction of hepatocytes. Repeated destruction of hepatic cells causes formation of scar tissue. 1 in 10 Americans have liver disease. Causes: chronic damage and injury to liver cells, viral or autoimmune hepatitis, the most common being chronic hepatitis C, alcoholism, non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, gallbladder disease, and cardiovascular disease. Prevention. Follow instructions on medications. If you take acetaminophen or other medications, check the package insert for the recommended dosage and don't take more than that. If you already have liver disease, ask your doctor if it is safe to take any amount of acetaminophen. Tell your doctor about all your medications. Even over-the-counter and herbal medicines can interfere with prescription drugs you're taking. Drink alcohol in moderation, if at all. Limit the amount of alcohol you drink to no more than 1 drink a day for women of all ages and men older than 65, and no more than 2 drinks a day for younger men. Avoid risky behavior. Get help if you use illicit intravenous drugs. Don't share needles. Use condoms during sex. If you get tattoos or body piercings, make sure the shop you choose is clean and safe. Don't smoke. Get vaccinated. If you have chronic liver disease, a history of any type of hepatitis infection, or an increased risk of hepatitis, talk to your doctor about getting the hepatitis B vaccine. A vaccine also is available for hepatitis A. Avoid contact with other people's blood and body fluids. Accidental needle sticks or improper cleanup of blood or body fluids can spread hepatitis viruses. Sharing razor blades or toothbrushes also can spread infection. Take care with aerosol sprays. When you use an aerosol cleaner, make sure the room is ventilated or wear a mask. Take similar protective measures when spraying insecticides, fungicides, paint, and other toxic chemicals. Follow product instructions carefully. Watch what gets on your skin. When using insecticides and other toxic chemicals, cover your skin with gloves, long sleeves, a hat, and a mask. And maintain a healthy weight. Obesity can cause a condition called non-alcoholic fatty liver disease, which may include fatty liver, hepatitis, and cirrhosis.
Diagnostic studies and clinical manifestations. Some of the signs and symptoms to look for with hepatic failure is jaundice, ascites, petechiae, spider angiomas, palmar erythema, pruritus, confusion, fatigue, GI bleed, fetor hepatitis, peripheral edema. Diagnosis is liver biopsy is most definitive way, ultrasound, CT, or MRI. Labs to look for are elevated AST and ALT, increased bilirubin, and increased ammonia. Decreased protein, albumin, red blood cells, hemoglobin, hematocrit, and platelets. Some of the complications with hepatic failure is portal hypertension, ascites, bleeding, esophageal varices, coagulation deficits, jaundice, portal systemic encephalopathy, hepatorenal syndrome, Nursing inventions include elevating the head of the bed to minimize shortness of breath, high protein diet with vitamins without ascites and edema, and signs of symptoms of impending coma. Restrict sodium intake and fluid prescribed. Monitor intake and output, fluid and electrolytes, weight, abdominal girth, and level of consciousness. Assess pre-coma state, tremors, or delirium. Monitor for asterisks. Monitor for fetor hepaticus. Maintain gastric intubation to assess bleeding or esophagastric balloon tamponade to control bleeding varices, if prescribed. Monitor coagulation lab results. Administer vitamin K if needed. Prepare for paracentesis to remove abdominal fluid with ascites. Prepare for shunting procedures to divert fluid from ascites into venous system. Procedures. Paracentesis with ascites to rid excess fluid. Want them to empty bladder ahead of time, then put in supine position with head of bed elevated and assess extricated fluid, color, and amount. Measure abdominal girth before and after procedure, and liver transplant.
Nursing diagnosis for hepatic failure would include excess fluid volume related to third spacing of abdominal and peripheral fluid, potential for hemorrhage due to portal hypertension, potential for hepatic encephalopathy due to shunting of portal venous blood and or increased serum ammonia levels. Medications include supplemental vitamins B, A, C, K, folic acid, thiamine, initiate enteral feedings or parenteral nutrition as prescribed, administer diuretics to treat ascites, administer blood products as prescribed, administer antacids as prescribed, administer lactulose to decrease and excrete ammonia, avoid opiates, sedatives, and barbiturates, hepatotoxic medications. So the first NCLEX question, the client has had a liver biopsy. Which post-procedure intervention should the nurse implement? A, instruct the client to void immediately. B, keep the client NPO for 8 hours. C, place the client on the right side. D, monitor BUN and creatinine level. The answer is C. Direct pressure applied to the site, and then the client is placed on the right side to maintain site pressure. The client should empty the bladder immediately prior to the liver biopsy, not after the procedure. Foods and fluids are usually withheld for 2 hours after the biopsy, after which the client can resume the usual diet. BUN and creatinine level are monitored for kidney function, not liver function. In the second question, the client diagnosed with end-stage renal failure and ascites is scheduled for a paracentesis. Which client teaching should the nurse discuss with the client? A, explain the procedure will be done in the operating room. Instruct the client a Foley catheter will have to be inserted. C, tell the client vital signs will be taken frequently after the procedure. D, provide instructions on holding the breath when the HCP inserts the catheter. The answer is C. The client is at risk for hypovolemia, therefore vital signs will be assessed frequently to monitor for signs of hemorrhaging. The procedure is done in the client's room, with the client seated either on the side of the bed or in a chair. The client should empty the bladder prior to the procedure to avoid bladder puncture, but there is no need for an indwelling catheter to be inserted. The client does not have to hold the breath when the catheter is inserted into the peritoneum. This is done when obtaining a liver biopsy. And these are our references. The end. Extra credit question. The client is diagnosed with end-stage liver failure. The client asks the nurse, "Why is my doctor decreasing the doses of my medications?" Which statement is the nurse's best response? A, you are worried because the doctor has decreased the dosage. 2, you really should ask your doctor. I'm sure there is a good reason. C, you may have an overdose of the medications because your liver is damaged. Or D, the half-life of the medications is altered because the liver is damaged. The answer is C. The main reason the doctor decreases the client's medication dose is an appropriate explanation for the client. A is a therapeutic response and is used to encourage the client to verbalize feelings, but it does not provide factual information. B is passing the buck. The nurse should be able to answer this question. D is the medical explanation as to why the medication dose is decreased, but it should not be used to explain to a layperson.